give them a milligram of immunosuppressant. They're like, why hasn't anyone done this for me before? I was like, I don't know.
Since me in the therapist position, I don't want to tell my client to go ask their doctor for a certain medication.
Right.
And then have like, a poor reaction. So is that something that they can Google and say, have that conversation with them? Like, is that easily
Yeah, their
accessible?
primary care doctor can do it. I mean, it's just a simple blood pressure medicine.
It's a blood pressure medication.
Yeah, they came about with the VA for trauma returning soldiers. They had started it years ago, and I mean, the minute someone says they're having nightmares, I'm like, right, this is going to be the easiest way to build rapport because I'm going to get rid of that on night one, and then they're going to think I can fix everything. And so, just a milligram of mini press, they sleep fine. They're like, oh my God, it's the first time in months I haven't had a nightmare. I'm giving away our secrets.
Yeah.
That's okay. That's okay. I got more.
So, in your presentation, you said that some people don't like to diagnose bipolar, like within like that 6 months, 12-month window. Like, I know methamphetamines, like.
Sometimes it slaps you in the face, though.
Yeah. So why is that? Like, does it stay in your brain longer?
It can change the way your pathways work and the way your neurotransmitters are interacting. Like, I mean, I have people that have been using methamphetamines chronically who are now psychotic. If they had never done the methamphetamines, they probably wouldn't have. They just switched something on. Or like, non-clinical people say they broke something in their brain from doing it so long.
I have one more question. I'm sorry. Does ethnicity have an effect on the way that medication works?
Yes,
Yeah.
can definitely. And a lot of that has to do with that heritability I was talking about, the genetic variations in our liver. Unless somebody's in here with cirrhosis or non-alcoholic fatty liver disease, our livers are healthy, but they're very different. And the way I like to look at it is our livers are as unique as our hair color, our skin tone, our body type, our response to foods. I like broccoli, you don't. And so those are inherited, and they are very important. And in fact, some of the major reactions, severe life-threatening reactions, were initially ignored because race and ethnicity were not taken into account. A good example is many people in the Asian population handle alcohol very differently. Females handle alcohol very differently in many cases.
I still think it's ignored, though. You don't see stuff.
Oh, no, it is totally ignored.
Right.
It
It's
is.
just we kind of, after you get some experience treating patients, like in our heads, we'll still be like, this is an African American male, or this is a Caucasian female. I'm probably going to have a little more success treating sleep, for instance, going with one medication in one population. It's not going to be blanketed, but just due to experience treating people in the past, you might be like, well, I'm going to try this with this population, or like a small Asian female, or, it depends on a lot of stuff. It's not just ethnicity, it's sex, it's weight, it's other comorbidities. So there's a lot of fine. I liken it to a game of Plinko. Remember from, what's that, Price is Right? I haven't watched it in 25 years, but I don't know if they still do it. But they drop the little coin from the top and it hits the little sticks until it gets to where it's going in the bottom. So we use all of the symptoms and specifics about the patient, their medical conditions, their size, their ethnicity, and we kind of pick medications that we think will work. And then we go from there.
So I just want to add something to that. When it comes to ethnicity and race, there is one particular medication that is a major factor, and that is Lamictal. In fact, the FDA came out with a recommendation that if you are not a Caucasian individual, you're African American, if you're Asian, you should have to undergo genetic testing to start Lamictal, because it can cause a symptom called Stevens-Johnson syndrome, where your skin will pretty much slough off your body. So if you're not a Caucasian individual, that is one medication that...
Other than that side effect, it's amazing.
I just first want to say thank you for being here. I know for us on our side of the street, having access to you guys is so hard for us. And so when the medical professionals are willing to come in and talk to us, it's huge to be able to have this. So thank you. And then I'm curious, is there anything coming up that y'all are excited about, or anything
So usually the annual conference I go to is Psych Congress. And one of the things I like about it is it's very clinically based. About once every 5 to 10 years, I'll go to the American Psychiatric Association. That is far more what's in the pipeline, very scientific. But at Psych Congress, one of the points that was made a couple years ago was that the 90s were supposed to be the decade of the brain. We were going to have it all figured out. And we were really working on 3 receptors that Dr. Kim talked about: norepinephrine, dopamine, serotonin. And then lately, especially with all the things that we think of as recreational drugs that are being looked at for clinical purposes, researchers really stepped back and started looking at it, and I'm going to quote 10%. 10% of the neurons in the brain are dopamine, norepinephrine, serotonin responsive. That means we've got 90% of the brain that's untapped, but research is starting to look at that. Opioids can be highly addictive, but there are many people, the unicorns, who will tell you, I only feel normal when I take an opiate. So how do we exploit the good and take out the bad? And so that's just one example of what research is starting to look at. We've got to start looking at different, psychedelics, I mean, all of them. And I mean, 5 years ago, 10 years ago, if somebody had told me I would ever be having a discussion with a person sitting in front of me about ketamine, I would have been like, absolutely not. No clinical reason whatsoever. Well, guess what? Studies have changed my opinion. So, yes, very excited about research. Yes. Yeah.
Okay. Can you, speak, I don't even know how to ask what is in my head, but basically, speaking on the use of Devlin and methylfolate and how important that is for like us to understand and advocate for the gene I'm gonna butcher. So
Methylene tetrahypofolate reductase deficiency.
Or as we call it,
L-methylfolate?
Methylfolate.
MTHFR.
So, again, this falls into the tail ends of the bell curve, right? Many people don't have problems with this enzymatic activity. It doesn't cause them any problems. It doesn't cause any mood symptoms, anxiety, sleep disturbance, anything. But for those of us that have it, me included, it can wreak havoc on how we respond to medication. If I have somebody, and I've learned to ask, do you have a history of blood clots? Do you have a history of miscarriages in the family, not just the individual? Do you have any unusual neurologic symptoms that nobody's been able to figure out? So on and so on. I've got a standard set of questions that I ask. And I start asking these when somebody comes and tells me they've been on, quote, everything, and, quote, nothing works. And so if you go through that quick screening list, do I have them get tested? Sometimes. But sometimes do I start them on Deplin just because? Because one of the worst things that can happen to people with that genetic variability is that if we put them on cyanocobalamin, B12, and it's not the methylated version, we can actually make things much worse. And again, those are outliers.
My personal opinion, like, I mean, you don't agree with this, but I don't prescribe Deplin. I just tell them to go on Amazon and just get the highest rated methylfolate that they can find. It'll save you a bunch of money. There's no evidence that the added seaweed ingredient that Deplin has does anything else special. They're telling us to wrap it up. Y'all can come grab it.
We'll be in the back.
But until they come take it from us.
From genetic testing, are you guys finding that a lot of the prescriber community is more open-minded to doing genetics?
Rare cases. It only tells us how it's metabolized in the liver. They make it sound like it's going to be amazing. It only helps for those outliers, like Dr. Parsons was talking about, that really are just having weird.
Yeah, and the problem with genetic testing is they haven't come out with any guidelines. I mean, it gives you this information, but there's nothing to say, well, if you get this result, do this, and that leads to the best outcomes. And that's the problem with genetic testing. I mean, the patients like it because